See, there's a misconception in people that if I got COVID, I am protected. I don't need vaccination. The kind of immunity you get after the vaccination is definitely much more robust. Some patients start automatically self-medicating with the flu vaccine.
Right,
This is
right.
not correct. You cannot, self-treat or just read some social media messages and think that, oh, oxygen level is going down. Let me just do some breathing exercise. It'll get better. No.
Hi, this is Toshi and you're watching India.com and the health site. So recently we've seen a surge in the number of Omicron cases, not only in India, but across the world. In wake of which a lot of states have put in curfew-like restrictions to curb the number of cases. Well, today we have with us Dr. Shalini joining us from Fortis Hospital to make us aware about the new strain of COVID-19 Omicron. Welcome, Dr. Shalini, to India.com and the health site.
Yes, thank you so much for inviting me. Let's go ahead.
Yes, doctor. So first of all, we've recently just seen a surge in the number of Omicron cases. So to our viewers, first of all, if you could just give a gist as to exactly what Omicron is.
So basically, we know we've been dealing with for last almost 2 years now, the SARS-CoV-2 virus or COVID-19, as it said. So viruses do have a tendency to mutate. We have seen influenza virus. We have a lot of mutations. So basically, there is a mutation, but it is more mutations which is expected. So the Omicron virus have changed few characteristics, which it has become more infective. But from the initial reports which we've been seeing from other countries, firstly from South Africa and lately from European countries and US, it is clear to us now somewhat for the limited data we have that it is quite infective, but it is not causing more hospitalization and deaths as of now. As we see, time will only tell.
Right, doctor. Also, not only we've seen a surge, but also, people are also getting a little panic because, the transferability rate of the variant is comparatively very high as compared to the Delta variants that we saw in the past. So, though a lot of reports, as you also mentioned, that the, transferability rate is high, but the symptoms or the infection is not as much as compared to the Delta variant. What do you have to say on that? Is it true?
As we are seeing in the other countries, the morbidity, meaning the way the people get sick, the severity is less, and the hospitalization is also less in India also, but it is very initial preliminary stage for our experience. In the last 2-3 days, what I can say is I've seen many patients who turned COVID positive and their entire family was positive. So and they have been sent for genomic sequencing, but I don't have the results. But it's quite possible because they were all had some travel history from within India. So possibly, people are getting infections very quickly.
So, doctor, another thing that we've seen is the treatment. So, is the treatment for Omicron similar to the cases for Delta or any other variant that we've seen, or a different treatment is being done for Omicron specifically in hospitals, if I see?
Basically, the for the treatment of SARS-CoV-2, we have a treatment how we have been treating COVID-19. Of course, there have been changes in the protocols. So the genomic sequence will be sent to the government, and by the time the report comes, we don't wait for the genomic sequence to see. Basically, it's a COVID-19 SARS-CoV-2 virus. So the treatment would be, to treat the patient and make sure the oxygen level is okay, and I would not like to go in the treatment part because it's quite medical.
Right, doctor. Another thing that we see that, a lot of home isolation and home care is being seen in this specific, if I may say so, the third wave which we're entering into. So for home care, what patients need to, keep in mind? If you can list out a few things.
So basically, I treated many cases at home in Delta variant also. It's not that only Omicron is mild. Delta variant, most of the people we were treating at home because 80% are mild cases. only 15% need hospitalization, out of which only certain amount needs the ICU care. So it is first thing first, it is important to identify that you have fever or any symptoms which you feel are are suspicious. You have to isolate yourself, and then consult a doctor, get it tested, and consult a doctor with a video consultation. It's very important to be in touch with the doctor continuously. You cannot self treat or just read some social media messages and think that, oh, oxygen level is going down, let me just do some breathing exercise, it'll get better. No, even if the oxygen level goes down or any other complications, we would tell patient to come to the hospital and get admitted.
Right, doctor. Also, we've seen, as per the studies, as per the data that has come in until now, that, the Omicron is not specifically affecting the lungs to, in death or something. And also, we've seen that, a lot of beds are not occupied as of now. So, what is the conditions in the hospital as of now, if we say, because, there's a lot of panic about this, if you can clear this for our viewers?
So basically, with Omicron, there is nothing to panic. It is the same COVID appropriate behavior. If people follow, it would definitely decrease the transmission from person to person. Yes, I agree. There is a lot of pandemic fatigue. What we say is like people are so tired of doing the isolation and not going anywhere, that people have all come out in herds, like you saw the pictures of Baga Beach in Goa. What happened should not have happened, but it has happened in Europe also after the Euro Cup, and there were thousands and thousands of cases. So basically, how the pandemic will shape up depends upon the people behavior.
Right.
And it is not possible to have so many crores of beds ready for patients if in case they need. It is the people behavior which is going to decide if they are wearing mask. And believe me, this is N95, and if it is worn correctly over the nose like this mask doesn't differentiate if a Omicron is entering or Delta variant is entering. It will protect you from both. And
Right.
the third and the fourth, no matter how many variant comes. So if
Right.
you wear an N95 mask, if you're going to a very crowded place, or a surgical mask, double masking, it will definitely save you. Booster dose will come when it comes. So first, the booster dose will be given to the children, to the healthcare workers, and above 60. So instead of waiting for the booster dose and thinking, and people think that they have taken two shots, they cannot get infected. That's a wrong way. I have gotten two doses last February. I am still wearing N95 all the time. So it is very important to wear a mask, social distancing and sanitizing, and not touching your eyes, nose, mouth, anywhere. Keep it
Right, doctor.
sanitized, and not touch the outer surface of your mask. If you have to take it off, take it on. You have to touch the strings. It's very important to know how to wear a mask and how to care for a mask.
Right, absolutely. Mask is a shield for us that has been protecting us for over 2 years now. And even now, be it any variant of SARS-CoV-2, it will protect us. So therefore, you have to keep wearing your mask, keep sanitizing, and, you don't have to touch your faces, as doctor has mentioned. But doctor, we've seen recently, that vaccination drive is full on. As you also mentioned that you got vaccinated, and now even children, teenagers between 15 to 18 years are getting vaccinated. So does a vaccination really help in protecting and immunizing the person, if a person is getting affected with any sort of variant, be it Omicron or any new IHU variant? A lot of variants have come in recently also. So what is the role of vaccination?
See, there's a misconception in people that if I got COVID, I am protected, I don't need vaccination. The kind of immunity you get after the vaccination is definitely much more robust.
Right.
It is definitely very important to vaccinate the children, because they need to ultimately go to the school. So if they are vaccinated, they will be protected. And there is no data which has come now that saying that if you are this vaccine which we've been getting in our country or anywhere in the world is not going to protect you from Omicron. There is no data like that. So definitely this vaccination is definitely produced in India, the Covishield and the Covaxin. is quite effective. Everybody should get vaccinated at their turn, especially parents should get their kids vaccinated, because ultimately a child could be a carrier also. Children have to be vaccinated. And I think 12 to 18 is already approved by the DCGI, and it has been all cleared. I think in due course of time, 12 to 15 will also be getting vaccinated pretty soon. And there should not be any doubts or hesitancy with the vaccine, because the same vaccine has been already given to 140 crore Indians, and we
Right.
are all doing very well.
Also, doctor, we've seen that, recently, in fact, today, a medicine of Dr. Reddy's has been approved. What do you think that, such medicines would help us take over COVID, or will that be used in the treatments at hospitals as well?
I think you are trying to discuss about an antiviral medication. So
Right.
we have been using an antiviral medication, by the way, which is very different from the influenza treatment.
Right.
There was some confusion with some patients start automatically self-medicating with the flu vaccine.
Right.
This is
Right.
not correct. It is not a flu vaccine. This is a totally antiviral against, it works against COVID also.
Right.
We've been using another antiviral. And the second one, which is already approved by FDA in US, and it has been launched in India, has been approved with DCGI and is currently available. And yes, I have been using it for last few days since it has been available as an antiviral, because studies have shown if started very early in the disease, very early, I'm talking
Right.
about second, third day, it would be antiviral and it can kill the virus. So let's see, we have limited data all across the world, but yes, I've been using it.
Right, Dr. Shali, thank you so much for taking out time for India.com and the health site, and explaining our viewers and clearing all the misconceptions regarding the new variant of SARS-CoV-19, Omicron.
Thank you so much. And I will leave and I'll put my mask on again.
Yes, thank you,
Bye-bye.
doctor. Thank you so much.